Today, I just want to talk briefly about the nocebo effect as it relates to birth. And so we, generally speaking, widely accept that the placebo effect is a real thing. The effect of experiencing healing or improvement of a physical or mental condition because we believe that some intervention will benefit us. So that's kind of my casual understanding of it. But a definition of placebo is this: a harmless pill, medicine, or procedure prescribed more for the psychological benefit to the patient than for any physiologic effect. Another way of thinking of this is that the healing impact occurs when a person feels nurtured, when they're paid attention to, and when they believe that what they're doing will help them. This also tends to relax people, creating feel-good and healing hormones like oxytocin. But what if the opposite was also true? What if problems and complications are proliferating because we're spending so much time looking for them and believing that they will occur? So a definition of nocebo is this: a detrimental effect on health produced by a psychological or psychosomatic factor, such as expectations of treatment or prognosis. This kind of situation creates restriction in the body, anxiety in the mind, limits oxytocin, and can create negative outcomes. Most of us have probably heard of white coat syndrome. For example, when a patient, or even maybe in your own experience, your blood pressure reading is significantly higher than your normal value because of the anxiety you experience being at the doctor's office and potentially anticipating undesired prognosis or diagnosis. It may even be the case that your blood pressure reads as hypertension, and that may lead to also being prescribed unnecessary medications, leading to polypharmacy and a whole host of other issues. And actually, interestingly, I was recently doing some research on cholesterol from this book, Understanding Diagnostic Tests by Anne Fry. And even cholesterol can be raised just by being stressed out or being at the doctor's office, up to, I think the value was about 50% of the normal value. So one of the ways that they measure it, the numbers were 140 to 200. I forget the unit, but being stressed out during the test can raise your cholesterol up to 100 points. So you could, maybe your cholesterol's in the range of like 160 or something like that, and being stressed out when you go to get the test taken, maybe it reads up to 260, which is higher than the normal range. So that's all to say that one of the things that I've been thinking about is that the words we use are important. We often spend most of a pregnancy relating to it in terms of what could go wrong, such as, oh, you hit that milestone and nothing's wrong? Great. But you never know, it still could. We look for heartbeats, there's the anatomy scan, are all the parts there, genetic conditions, gestational diabetes, growth compared to gestational age, head down, cord too long, cord too short, cord wrapped around the neck, low-lying placenta, too much amniotic fluid, too little amniotic fluid. You can't have your water broken for too long, but also everybody wants to break it to move labor along faster. But remember, the clock starts now. Then there's the continuous fetal monitoring. But oh yeah, it's not always accurate. And it can also pick up mom's heartbeat, which will read, unless you know that that's what it is, you'll perceive it as a dangerously low baby's heart rate. And also push when we tell you to so you won't tear, but also you have a higher risk of tearing if you're doing coach pushing, and especially with an epidural, and it just goes on and on. And pregnant mothers are related to according to their risk level. And have we ever stopped to consider the effect of that? We push interventions and screening as a society, and in order to catch things early and to save lives. But what about all the anxiety we're giving mothers when they should be calm and peaceful? What about all the misdiagnoses and all the unnecessary interventions? And all the C-sections and inductions that are causing grief and stress and separation of mom and dad and baby, and affecting bonding and breast milk and brain chemistry and propensity for postpartum depression and hemorrhage and so on. Midwives are now expected to know and implement things that are great skills for high-risk pregnancies. But for every midwife to implement them with every normal pregnant woman, this leads to a proliferation of the nocebo effect. We don't know all the effects our modern practices have, but what are the options if you don't want this? There seems to only really be one prominent framework for maternal care, and it's okay to want something that's different than what we're offering at the moment, or what generally is on offer at the moment. It's okay to want nurturing and relationship over risk and screening. It's okay to want to foster oxytocin and relaxation over adrenaline and contraction. There's not, this kind of thing is being thought about more and more, and there are women who are coming into birth work and training to be birth attendants who are aware of this and aware that not all women want the clinical medical model, and we're preparing to be able to help women have the births they want and potentially avoid things like the nocebo effect and having negative outcomes simply because we're expecting negative outcomes or a negative prognosis. And yeah, I think the mind is really powerful, and I think it can affect things for like positively or negatively, and it's something that we have to consider when we're especially as caregivers and how we approach care of people, and not just in birth, in all different spheres of healthcare. Anyway, that's it for today. Thanks for listening.